Advocating for yourself when it comes to healthcare can be hard, especially for members of the LGBTQ+ community. Here are some tips for self-advocacy. Tip number 1, documentation. Before going to a medical appointment, keep a record of your health experiences. Include information about your symptoms, such as their duration or what triggered them. This can help you in describing any health problems to a care provider. During the appointment, take notes about what your care provider tells you so that you can refer to them later. Ask for copies of any scans or test results that are done so that you can have your own records. If a provider refuses to provide a test or treatment, ask them to note that in your medical record. This way there is evidence that you requested that test or treatment and were denied. Tip number 2, research. If you are able to, try to do some research of your own before the appointment. This may help you to ask more informed questions when talking with your care provider. There are some health risks that may be higher for members of the LGBTQ+ community. Check the description box for links to resources that cover health risks that you may want to discuss with a health care provider. Tip number 3, bring someone with you. Healthcare settings can be overwhelming sometimes. Try to find a supportive family member, friend, or significant other that you trust to go with you. This person can be a source of emotional support. They may even be able to vouch for your symptoms. Tip number 4, coming out to your healthcare provider. It can be intimidating and maybe even unsafe to come out to your healthcare provider. Ask yourself some questions before coming out to your provider. Are you able to choose your own provider, and can you switch if you are not happy with them? Do you think they may treat you poorly if you come out? If you are choosing a new provider, call ahead of time to ask questions about that practice's experience with LGBTQ+ patients. Are there any other LGBTQ+ patients? Do the staff have any training for working with LGBTQ+ patients? Does the practice have a non-discrimination policy? If you decide to come out to your provider, try to bring it up early in your work with the provider. Do it when you feel less vulnerable, such as when you are still clothed or after chatting with the doctor for a bit. Use any research that you might have done ahead of time to know what questions you should ask. Finding an LGBTQ+ provider can be difficult. Check below for guides to finding a healthcare provider. There is a high demand for LGBTQ+ healthcare providers, so it may be hard to access them quickly. If you have an immediate concern, check below for links to LGBTQ+ friendly resources such as phone lines or online chats.